Hi guys, Dr. Davin Lim, board certified laser dermatologist. Today's topic we'll be talking about one of the most commonly asked questions I get, which is basically how to treat smokers' lines or upper lip wrinkles. Basically, we got to understand why do these lip wrinkles happen. Now, invariably, I treat women rather than men, and here are the facts. The reason why these wrinkles happen is because of genes, so it's genetics. Modified by the environment. So basically, the more UV exposure you have, the more chances are that you're going to have upper lip wrinkles and sun damage. Thirdly, smoking. So it's one of those environmental factors that really make a difference with upper lip wrinkles. That's why they're called smokers' wrinkles, because it actually affects the collagen. And last of all, yes, I know I'm going to get lots of dislikes with this, but it's a proven fact that women talk more than men. And as a result, it's just like crow's feet, you know, the wrinkles, you get smile lines out here. They're called dynamic wrinkling. And dynamic wrinkling can be tested upon puckering. So women who talk a lot, or I guess men who talk a lot, like myself, should in theory have wrinkles. So you can see when I ask patients to animate, how much of their wrinkling is due to actual dynamic wrinkling or wrinkling due to movement. And the way to test that is to ask them to pucker. It could be due to women talking more, but I suspect as well it could be due to lipstick. So I've never worn lipstick myself, but I presume this movement a couple of times a day probably predisposes to wrinkling. So this is how I remove upper lip lines and smokers lines. So thanks for watching guys, and I'll show you how it's done. Part 1 is assessment, the most important part. So the very first thing to do is to assess whether someone's got dynamic wrinkling, like this, which is wrinkling with movement, or wrinkling at rest. The first thing to do is test, and this is how I do it. Static wrinkling is really easy. Basically, it's wrinkles which are at rest, but most people have an element of both dynamic and static wrinkling. So lasers for fine lines. So what do? I like using a fully ablative laser, especially for static wrinkling. And the laser I use is what's known as an erbium laser. So this process is conducted under sedation and blocks and is really a painless procedure because with the amount of lip blocks and sedation, patients feel absolutely nothing. The procedure itself takes about half an hour to do because it's really important not just to treat the lines, but to treat the surrounding skin. In other words, to blend things in. This way it gives a nice natural result without what's known as the milk mow or the whiteness around the area. So here are a few examples of before and afters so you can see a marked improvement. This lady had static wrinkling and once again static wrinkling. In other words, wrinkling at rest treated with fully ablative laser resurfacing. So you can see the befores and afters. A marked improvement, but you can see there's no demarcation lines between where the wrinkles are treated and her cheeks. That is very important. It's extremely important because in old-fashioned days you used to see the milk moustache and that's a bad look. Microneedling RF I also use for treating upper lip lines and I often use that with PRP. So microneedling's got minimal downtime compared to laser resurfacing, but the downside is that it needs 3 to 4 sessions. In my opinion, it can give a good result, especially if combined with fillers, but the downside is that there are multiple treatments that are needed. Fillers. Well, I use different types of fillers, including... Okay guys, I'm doing an off-label injection using hyperdilute Radiesse to the upper lips, and that's to use this to decrease the amount of wrinkles. So it's not a 1-to-1 dilution, I'm actually diluting it realistically 1 to 3, and what I want to do is stimulate collagen production over the next couple of months, and we're going to reduce the upper lip lines without the use of laser resurfacing. So this is my off-label use. So she's had some local anesthetic to the area and hopefully it should be quite numb, and the injections itself are quite fast and they're very superficial, and I give it a very good massage after that. So that's it guys. Hyaluronic acid fillers, or HA fillers, are the most commonly used fillers I use. These include Restylane, Bolotero, and the Juvederm range. We can use fillers in different methods and techniques. We can use what's known as dermal hydration, like you see here. It's basically just hydrating the dermis. And we go very superficial, using a very fluid filler, and then give this a massage. And that will take away fine lines and wrinkles. Another way is a direct injection technique. So I ask them to actually pucker up and actually inject in between the folds or lines. And I often combine this with a vertical technique and also a horizontal technique. So this is a vertical technique to the lines, and then I go in horizontally and do these what's known as micro aliquots of filler. And this way we get a nice result and just enhancing the lip border here. So one of my favorite techniques, because this has very little downtime, a bit of bruising, but it can give you excellent results, especially if done correctly. So one of my favorite techniques, fillers over laser if downtime is an issue. But if you have static wrinkling, certainly lasers can work really well. What I hate most is actually this procedure. It's called micro Botox. So what we use about 3 to 4 units, and we place it very superficially along the lip border. The reason why I don't like it is because you actually paralyzes the muscle, or partially paralyzes the upper lip muscles, and it does give you difficulty in talking or animation and drinking and eating for a couple of days. So in my opinion, yes, this can help. Do I like doing it? No, I don't, but certainly it does work. So there you have it, guys. Guys, thanks very much for watching that very short video on how to treat smoker's lines and upper lip wrinkles. Look, the bottom line is this: it's prevention. So you can do what you can to actually prevent that. That includes wearing a high factor SPF sunscreen twice a day, environmental factors, in other words, sunscreen, and try to cut down your smoking as well. I wouldn't say don't talk so much, because look, that's not it's not really relevant, is it? So we really need to have our own personalities. So guys, that's it. How to treat lip wrinkles in a simple 5-minute video. Join me next Saturday, and we'll find out another topic we can talk about, and I can show you how it's done, and the befores and afters. So one new video, if you're new to this channel, one new video every Saturday morning Brisbane time, and I hope to see you then. Please subscribe if you like this channel. I really do appreciate your support, and yes, channel's growing at a really good rate, and thanks to all you supporters out there. So I'll see you next Saturday. Bye.